So near and dear to my heart recently is personal diagnosis of femoral acetabular impingement with even a little bit of a labral tear. And so many of my patients with hip impingement or hip pain who ride bikes are getting better from things that we do in therapy that sometimes don't seemingly make a whole bunch of sense. So one of those things I was really pleased to see in the Journal of Orthopedic and Sports Physical Therapy came out this month. Femoral acetabular impingement and osteoarthrosis in a patient with hip pain. And this is volume 41, issue 3 by McDonald. It really jived with what I've been finding personally as well as professionally to help out my patients with hip pain and or low back pain on or off the bike. So what all of those fancy words mean is that if you look at the connection between the thoracic spine and the lumbar spine, this thoracolumbar junction, this place where these two areas come together, an area of relative stability in the rib cage and a relative mobility in the lumbar spine. This area in the middle frequently gets stiff in cyclists. It's the area that as people bend over the bike, they end up hinging in that thoracolumbar junction. So people end up with a lot of tightness here and a lot of stiffness in the joints. The musculoskeletal issues are fascially bound up down here. There's also some nerves that come out of here that combine together and then run down in the front of the hip. So what this research article / case study, and there's another one out there as well that I saw, says that if this is immobile and this is stiff, if the thoracic spine and particularly this TL junction is stiff and you mobilize it, then you start to get more mobility in the hip joint itself. So when you're on the bike, the hip has to be able to bend up and fold. And if the hip doesn't fold very well, you start to get an impingement, a jamming up. You start to get a jamming up of these bones right here, the hip joint, if you will, femoral acetabular pinching. So when these bones don't slide and glide very well, they bump into one another, and then you start to get some discomfort, and particularly when you're coming over the top of the pedal stroke, or what the body will frequently do is if the hip is tight, you start to round the low back to take stress off of the hip. So all that to say is low back pain and even sometimes knee discomfort can come from a hip that's not moving well. So getting more mobility in the hip, and now, and this is what I've been seeing with patients, getting more mobility in their thoracic spine and their thoracolumbar junction is really critical. So the next video is going to be about what you can do about that and how you can start to mobilize your TL junction and how you can start to mobilize your hip to allow them to move a little bit better.